Hi, my name is Cindy Stein. I'm a licensed physical therapist at Squirrel Hill Physical Therapy. I'm also a veteran of the U.S. Navy, where I was a physical therapist both at Annapolis and at the Philadelphia Naval Hospital. While I was in the Navy, I encountered a lot of people that had traumatic brain injury and PTSD. As a physical therapist 35 years ago, I really didn't know how to treat this. In the last 5 years, I've become very interested in treating these concussion syndrome, traumatic brain injury. I first was trained in craniosacral therapy, which works on the sutures of the skull and the bones of the skull to help to release the forces that have gone into the skull. Our skull is movable, even though some people think it's solid. It isn't. Each one of these bones can become impacted during any force that goes into the head. So ultimately what I'm trying to do by doing these techniques is I'm trying to disimpact these bones that have been impacted by force. One of the best techniques that I've come across recently in the past year and have been trained in is called Nasal Release Technique. This technique takes a blood pressure bulb with a finger caught affixed to it. It then is put into the 3 different sinuses, inflated, and as a result of it going up into the sinuses, it causes the bones of the skull to be manipulated, thus disimpacting forces that have gone into the head. I have seen tremendous results with this technique. I know that there are many men coming back from Afghanistan and Iraq that have been impacted by traumatic brain injury and PTSD, and I really want to bring this structural work to them because I have seen such incredible results with my concussion patients here in Pittsburgh. After 1 or 2 treatments, I have seen people that have had 8 years of problems. Their headaches go away, their fogginess go away. I had a patient who had gut pain and diarrhea and weight loss as a result of her concussion. 1 treatment, it eliminated those symptoms. I think that it is very important that we bring this work to the military, not only active duty, but also VA. Thank you for your time. Today I'm going to demonstrate a technique called nasal specific technique or nasal release technique. This is a technique that I use on my concussion patients to disimpact the forces that have gone into their head. What I'm going to do is I'm going to take a blood pressure bulb with a nasal caught affixed to it. I'm going to place it into the 3 sinuses and I'm going to inflate the balloon. What the balloon inflation does is it manipulates the cranial bones from the inside of the skull. I first begin with the lower sinus. I place it in with a toothpick. I close off my valve and I inflate. I go to the other side and do the same thing. I then go to the middle sinus on the right side. Middle sinus on the left side. Upper sinus on the right side. And that one came out, so it meant that I wasn't in the sinus. I'm going to reinsert. This technique is highly effective for getting rid of the last few concussion symptoms that other treatments don't seem to take care of. So I'm doing the upper sinus on the left. And then I complete the technique with the 2 lower sinuses again. I know that I have complete opening of the sinuses when the balloon actually goes down into the throat. And after we're done, she'll tell me whether that's happening or not. lower sinus, left side. And that's the procedure. Tell us what you felt with that.
A lot of opening. I did feel a little bit of cracking of my internal sutures. And just as soon as she was done, everything kind of opened up as soon as she was done with each of the nasal passages. Just kind of felt some things draining.
Typically, after the procedure is done, a patient can drain for anywhere from 1 to 3 days. I begin to see effects from this technique sometimes after the very first session, but usually it takes anywhere from 5 to 8 of these treatments to really get lasting results. If you have any problems like this, I would highly recommend this treatment for concussion symptoms. Thank you.
Hello, my name is Mel Kukic. I've been a chiropractor for 24 years. Since about 2008, I traveled to Okinawa and did some fighting over there for karate that I've been doing for a number of years. And during the plane ride and while I was over there, I was hit in the head and experienced some head trauma. And when I came back, I started having dizziness and lightheadedness, and particularly in a seated position, and exacerbated when I looked down. I had no relief. I tried a bunch of different things and natural therapies until Cindy did her nasal release technique on me. Since then, it's been much better. I also used to compete with shotgun tournaments, sporting clays, and thousands of shotgun blasts a year. I used to shoot more than 10,000 targets a year, and that played some part in my head trauma as well as my tinnitus. The tinnitus is improved right after Cindy does her work. The dizziness has greatly improved, and I rarely experience it anymore. So I want to say thanks to Cindy and her work, and I'm glad she's able to provide that for me.